glad to have everybody. We've got a great presentation coming up today. We have Miss Sara Auld with Health Possible. So without further ado, let us get started. It's all yours, Sara.
Thank you so much, Lori. Everybody, thank you so much for having me today. I love doing these 1 Million Cups presentations. They're so fun. I'm really excited to bring Health Possible to you guys there in Fayetteville. We basically do everything we do online, so it's really easy for us to serve the whole state of North Carolina, and so everybody is aware I am based in Wilmington. Okay, so today I'll talk to you guys about the who and what we do, who we are, what we do, how we do that, why we do it, and then ways that you guys can help, which would be absolutely wonderful for us to spread this mission. So we are Health Possible. We are a 501c3 nonprofit corporation in the state of North Carolina. And what we do, if I can get this to go, we provide financial aid for holistic wellness healthcare. So in the form of scholarships, we will financially aid things like fitness, nutrition, and mental health care for people. And the more I talk about what we do with folks, the more I realize, that's really a fraction of what we do. It's primarily what we do, but also a fraction. We care coordinate, so we will align people with personal trainers, physical therapists, registered dietitians, mental health counselors, and all sorts of different conventional and non-conventional types of care. In the sense that people are learning in those fields so that they can learn how to care for themselves in each of those subjects better. So this is at our annual gala in 2019. We had a great turnout. We sold out. And this is also just going through, everything that we do is based on donations. They are tax deductible donations. Again, 501c3 nonprofit. The care coordination scholarships is primarily what we do, and we're also offering a microloan program that's coming out. So how we do that, so that's what we do and who we are, and how we do that is, of course, through the donation. Our clients will go onto our website, healthpossibleinc.org. They simply apply for financial aid with us to get the care they're looking to receive. A lot of the clients we get are also a patient referral from different medical centers, family practices, hospitals throughout the state. And we will qualify those clients based on their income. So based on, federal tax returns, 90 days worth of income, and all these other financial qualifications, we work with them on their budget. We then offer the dollars that we've raised up to a certain percent within our own policies, make that care coordination happen. And then once we schedule or once we contract with them, we begin scheduling the actual appointment and payment process for them. We manage that program all the way through to the end. So they really have us as kind of a care manager to improve their lifestyle. Now that's how we do it. Now, why we do it is, of course, for stories. So these are two of our clients who, actually technically three, but two of our clients who have seen great success from our program. I would say all of our clients have seen great success from our program. However, these two are very open about their stories. So on the left, we have Marty. Marty went from addiction to marathon running in the Health Possible program. So he became sober in 2015, and he still struggled with some of those just addictive behavioral habits. Came to us for fitness, nutrition, mental health counseling, the whole 9 yards. And we actually paired him with a company here called Without Limits. And that is just his pride and joy. And he took up the love of running, ran his first half marathon in the program here. He lost 40 pounds through our program. And then we've got Kwaji over here on the right with her daughter, Liana. Kwaji is a single mom. She was working part-time for the Boys and Girls Club here in Wilmington, came through our program, again, came in for the whole 9 yards. In about 6 months, Kwaji lost 25 pounds. She had something that's really hard to measure, which is confidence, growth in her confidence. She went from part-time work to full-time work with New Hanover County, and she left her previous apartment and moved into her very first own apartment, and came off of different government assistance programs. So she is just thriving on her own, doing so wonderful, and she just grows and grows every day. She actually texted me this morning that she just opened her own first business. I'm so proud of her. So stories are why we do what we do. We have clients who we've gone through suicide prevention cases, we've gone through weight loss programs, turned people into athletes. We have lost hundreds and hundreds of pounds in the state of North Carolina. Last year, we covered about 720 hours of care for our clients. We grew about 230% last year as well. And how this all came about was my personal story as well. So I used to be a personal trainer back in 2017, 2015 through 2017. I met so many people who could not afford personal training, knew that it was a life-changing service. You're borderline a physical therapist. And each time I met somebody who could not afford the service, I would go home every day and just try to figure out, if I'm going to focus on a demographic that does not have the finances to get this holistic healthcare, how could I then afford to eat at night too? So Health Possible came about. It just needed to be a nonprofit organization that could raise the money, fill that gap, right? We're focused on a very specific population with narrow goals. So we fill that gap, and then the nonprofit, of course, absorbs the risk of any kind of payment. Let's say somebody's in on a 50% scholarship, right? That means they have 50% due. Okay, so we've got our own provider network that we work with at specific costs for our clientele. And then if a payment does not happen, we of course enforce that, we follow up with them, but our donors are aware of that, the organization's aware of that, and it allows us to get people the care that they need, that they wouldn't normally be able to afford, and it really gets them on their own 2 feet. Again, in each subject, it depends what somebody's coming in for. We also have partners that offer financial counseling like First Citizens Bank. So we're really focused on the whole person, of course. So this is Health Possible. We've been open for about 4.5 years now. We are looking to make our footprint throughout the whole state of North Carolina. I've now presented in Wilmington, Lake Norman, here in Fayetteville with you guys today, and I'll hopefully be doing the Charlotte location and the Research Triangle as well. So we actually had a client in Jacksonville and Durham so far, outside of Wilmington. This year, we've gotten lots of veteran referrals. And I know that's obviously of popularity in the Fayetteville area. I've got a cousin who lives in Fayetteville, based there too. So we do serve veterans, and we get people from endocrinology offices. We get kids, adults, geriatrics. It's completely financially need-based. So if folks are in need in the Fayetteville area, ways that you guys can help us are referring us providers who would be of great service to our provider network. So again, those personal trainers, physical therapists, and yes, occupational therapy, recreational therapy, registered dietitians, and counselors of all kinds. And then clientele-wise, those are also typically your folks who can't afford it, right? People walk in their doors every day, want their service, and walk back out because it's hundreds of dollars an hour, or because it could be thousands a month. I mean, it really depends on what they have going on. So the provider network is assistance we could use. Referring clients over to us, we're here to help people, right? We're here to change lives. So anybody, I have family members I know who would benefit from what we do. So if you've got loved ones who would benefit from this, send them our way. And then, of course, donations, right? How we do what we do is there's a cost to providing care. So if holistic healthcare is something that you are really passionate about, and that's something you want to achieve in the Fayetteville area, getting people more self-sustainable in this area, I can work with you, and I would love to work with you. We would love to work with you on you making that footprint and making that happen. We can help deliver that service on your behalf. So donations, providers, clients, all the things that change lives. And that's Health Possible. Any questions?
Sara, what is approximately your approval percentage of people who apply versus people that you can help in any way, shape, or form?
Mm-hmm. So we will scholarship people all the way up to the 12% tax bracket. So approval rating, I would say we're well over the 80% approval rating, just because those are typically your folks who are applying, who are being made aware of it at the doctor's office. It's expressed often at the doctor's office, I can't afford to be on my 6th session of registered dietitians that my insurance will only cover so many folks are uninsured who are coming to us. And actually, I would even go above that. I'd probably say over the 90% range. We're currently performing a lot of our KPIs and cost avoidance and all that. So we're doing a lot of these metrics right now.
That's outstanding. How far is your reach right now as far as your clientele and your providers?
Clientele and providers. So clientele, we're right around 28 folks right now.
I mean, geographically.
Oh, geographically, yeah. So we have been primarily in Wilmington, and then we've had one client in Jacksonville and one in Durham. But again, right, that's because we're based here and I'm here and this is who we talk to, but we can serve the whole state. So we would like to expand that geographic location to the entire state outline.
Because I know some of those counties down near Wilmington, you know, coastal counties and the ones in between tend to have more need for things like that.
Yes. Yeah.
You know, you got your pockets of people who obviously can afford to live at the coast, but once you start getting inland, you got a lot of rural areas that it would be very, very needed in their area.
Yeah, so beneficial. And I think really a big deal too is virtual care now. I mean, so many things have become virtual in the pandemic. That was one of the hardest things for us to navigate, was providing care when they weren't allowed to see anybody, right? And then all of a sudden virtual care, it almost took off overnight, not necessarily for us, but as an industry. And when it comes to rural health, right, that's something we can provide now, is saying, hey, you know, we can get you that personal trainer over the FaceTime or the computer. And when there's barriers there, you know, we seek libraries. We've gotten laptop donations from Encino now. So there's ways that we can make it happen.
So basically in your area, and then I'll let somebody else chime in, but I'm just so intrigued by what you're doing.
Thank you.
So basically when somebody applies to you, they have to use one of your approved providers because they had to agree to the terms and conditions, or have you been able to bring in somebody's primary physician once they applied and all that, so you were able to retrieve them? Is it working both ways, or?
So we're not using physicians at the moment. So everybody we use is just in that holistic market. We would be open to naturopath doctors, but they're not legally allowed to practice in the state of North Carolina. But the providers that we bring in have to show us proof of license and certification, proof of insurance policy. They're able to practice under ID. And then of course we vet those things on their sites to make sure they're actually licensed. And then they agree with us on their rates. So we do try to work with all of our providers at a much lesser rate because of, say someone is on that 50% scholarship, they've got a 50% of that due, right? So they've still got a budget that they need to work within. So of course, the lower we can get our providers to work with us, providing them volume, right, in return, they're not losing prospects who can't afford them. They're not losing out on, you know, having gone into the industry to help people, right? We're going to help you help more people. So once they send us license, insurance, agree with us on a rate, that puts them in that provider network. And then of course, in our policies, we have specific industries we're willing to work with, which are the.
We're using the word physician because it was the wrong choice of words, but.
Oh, it's okay.
I can bring my own people as long as they're willing to comply with your requirements and go through the screening that you require and that kind of thing.
Definitely. And actually, I do want to kind of elaborate on that. So the reason we do that, I have a firm belief in consumer choice. Best practices is quality practice. It creates intrinsic motivation, and healthcare needs to be about relationships. So what we're trying to do at Health Possible is avoid this assembly line of care and this cold, you know, very, very sterile environment of you're going to get taken care of and then you're going to go over there and then you're going to get taken care of and then you're going to go over there, right? We want people to have a social atmosphere that holds them accountable for life, because they're not going to be in our program forever. The current maximum allowance of program entry is 2 years total. After 2 years, you have to exit. And we have exit strategy for them, but we are a relationship-based health. Holistic healthcare is about your positive influences, making friends, challenges, right? It's about being able to sustain your health, not just run over to the RD every time you have a cough or run to the doctor every time you have a cough. It's about sustaining good health, and a lot of that comes from relationships. So that's why we let them bring in their own people. I mean, I have people all the time that apply and they're like, well, I was seeing this counselor and then I lost my health insurance, but I really love my counselor. I don't want to tell my story all over again. Can I go to them? And we call them up and we're like, yes, we'll advocate on your behalf all day. And we say, hey, counselor, we've got a client who would like to see you. I just need these things from you. Would you be willing to do this? Would you be willing to help this person through us? And we've not been told no, to be honest. We have no providers who say, no, I don't want to help more people, right? They want to do that. That's why they do what they do. So it's great, but that's why we do that.
So Sarah, you have a stringent process for vetting your providers, but how do you recruit them?
I'm very just probably old school. And I get this, I feel like on every call I have. I just go door knocking and I make phone calls. And I did used to be a personal trainer. So I had the network kind of already established just in the personal training world. But once I got out of that, it becomes word of mouth, right? That's the best marketing there is. Now I go into meetings with large businesses and they're like, I've never heard of you. You've been under the radar. And well, we don't market because I just call people all day. But yeah.
I'm going to jump back in because, like I said, you are so intriguing me. It's a very good concept, and I'm glad somebody's out there helping people navigate through some of this stuff, because you're helping them not just with things that you can help them, but like when you help these people who have lost 40 pounds and now they're running, you have changed their health, so you're impacting not just your part of it, but their overall health as well. But
Yeah.
Here's an intriguing question for you, because I want to follow up with something Lori just said. She talked about finding your providers, but let's talk about your clients. Mm-hmm. One of the things that education is undergoing right now, especially in the state of North Carolina, is we have a lot of people who are what we call undereducated. In other words, they've had some college, but they've not completed a credential. They've not completed a certificate, degree, whatever. So across the state of North Carolina, because we're having a big gap in available jobs and workers, where we don't have qualified workers, we're trying to reach out to these folks to say, hey, come finish your degree, credential, or even those who've not started, come and get your degree so that you can be ready for these jobs. Mm-hmm. But the problem is a large chunk of that segment is the same group of people that you are talking about. Mm-hmm. So I'm curious, because it could also help us, how are you finding those clients that are in the need of what you do, because it's that sweet spot of the income and all of that.
Yeah.
How are you finding the clients? How are you getting your word out to your clients? Not the providers, but the clients.
Yes, the clients. We started with the medical centers. So our partners right now in the medical industry are New Hanover Regional Medical Centers, Nunley Pediatric Specialty Clinics, so the child clinic. And I would think that would be something really specific for you guys working with people to, if you're focused on the youth. If you're focused on adult clients, then of course you're going to go to maybe more adult-centered care centers. But people who work in health, now actually people in any industry have kind of a biased perception with their industry. So they'll see things. It's like you break up with somebody with one kind of car and all of a sudden you see that car everywhere, right? So if you work in an industry, you often see things through that lens. So when you work with a healthcare worker, they often relate things like bad grades. That's their first knee-jerk reaction is, oh, well, how can I fix this in my industry, right? So when you go to people in health and you're trying to find people who, don't have a job, or they work in jobs where you know that the pay is not going to be that of a CEO, or, we could go down a long list of where does my client eat, sleep, live, pray, hang out, shop, right? I could go down the whole prospecting, like qualified prospect list and say, okay, if this is where my clients are, now I'm going to go to somebody who sees it through that lens. So if you're looking for someone who can treat the healthcare side of what you're dealing with, which is a lack of education, I would go to medical centers or wellness centers who do have them and see them through that lens. Does that make sense? Mm-hmm. I'm not sure if I'm articulating that the best I can, but But we started with medical centers. And then I think the really great part about our first few enrollments was then it became word of mouth that we're also just, I believe this is a high statistic, but we're also like the people we're around, right? Or we become like them. So you often get people who have similar social circles to what they deal with on a day-to-day basis, right? And that's just communities, and how you make friends. So once we started getting our enrollments, then it became, oh, my friend has the same issue. Oh, my parents have this issue. My sibling, it goes on. And then we started getting family enrollments. So we had one mother enroll and then the daughter enrolled. We have a mother who has previously gone through our program trying to get her friends and her family involved. So I think that will be a continuous cycle for us that you guys might just also want to leverage as well. Once you find that person, who else do you know going through this, right? It's almost like a referral ask.
Mm-hmm.
I think that could be beneficial for you guys.
I hadn't thought about the referral. I do like how you stated the people where they go, where they eat, sleep, shop, pray, that kind of thing. Because you're right. If you don't take the message to them, they will never know you're there.
No, they do not. And we don't market. We're about to start, but we don't market. And I have to say, I think it's hurt us. How you market's one thing, but you have to market it. Mm-hmm. You have to get it out there, whether that's by a referral basis, whether that's by handing out flyers or sending mass emails or attaching yourself to nonprofits, tribe mentality, right? However you're going to do it, you do have to do it.
Because contrary to what people believe, it's not if you build it, they will come. That only applies to baseball fields in Iowa.
That's funny. I am a firm believer in pounding the pavement. You have to go get it. If there's ever an outcome problem, a revenue problem, any of these things, it's, well, what does the pipeline look like and what have we done to fill it up? Right? And that's my sales mind, but that applies to most aspects of business. Any other questions? Okay. I did put my email and phone number in that group chat. I'm sure everybody saw it, but please feel free to reach out to me if you have any questions you just didn't want to ask on the call. Feel free to text or call me. Work 7 days a week. We have Marathon Madness this weekend. We've got a 5K on Friday. If anybody feels like taking the ride down and volunteering, we still need volunteers. I know that's a drive, but happy to meet with anybody anytime. And thank you guys so much for having me.
Well, we're not done with you yet. I was just trying.
Oh, sorry. Nobody asked any more questions.
Trying to give people a chance, but it seems like some of them are still a little sleepy today. But where do you see your business growing to?
Geographically?
Well, geographically, services you offer, where do you want to take this?
So I would love to take it nationwide because everything we do is very reliant on using automation and technology, just that application process to that qualification process to the payment process. It's really simple, right? It sounds complex. And I'm sure every founder says, this has never been done before. They want to say that, but most people are intrigued because what we do is not common or really often heard of. So I do think that there's a huge need for that reason. I'm confident in saying that, and I'll say it all day long, that people don't do what we do, not in the way that we do it at the very minimum. So I do believe that every state needs something like it. I would like to take it nationwide. I would like it to obviously keep up its quality. I would love for it to become such a cult is not the right word, but I would love for it to become such a strong culture that our clients someday become our providers or our employees. I would love for it to be a cycle of I've grown so much that, and we have people who already asked me for jobs and I'm the only full-time employee at Health Possible. So we're just not there yet. But I would love for it to become that culture of permanent change and impact, really through, of course, mission driven, right? I've gone through it. Now I want to give it back. I've gone through it. I want to give it back. I think that's something I really strive for.
Do you see
I have a question for you? Oh, sorry.
No, go ahead, Jesse.
Who, based on your answers just now, who is your competition?
Who is our competition? I would think our competition now from an income standpoint or just from a doing what we do standpoint.
From, well, services, you can answer both, but
Yeah.
mainly your services. Who's your competition locally, and probably you're talking about expanding your business nationally. So who out there is your competition now, and what are they doing?
Mm-hmm. So I will say we did have our concept and our model and a company copied once about 1.5 years, 2 years ago. And I'm not going to say that brand on here, but we did completely get copied by somebody we invited to be a provider, who then went off and actually opened one here in Wilmington. So that is our first true competition and a driver for us personally, and that's fine. Friendly competition, it's all good. But so when it comes to, I guess, income, this is not the right answer that you're looking for. It's the right answer for me, but it's a cliche answer. I think our competition is honestly human laziness. And I think our competition is also just people's seek for a quick fix. Intrinsic motivation. I mean, providers who want to provide the service without us. Any provider who would tell us no just became our competition, right? We want you to want us because we're trying to do this on a volume basis and serve more people. And not for nothing, we're also trying to bring down the cost of holistic healthcare. It is through the roof. It is so expensive. I mean, without insurance that covered specific things like physical therapy or, a counselor, I couldn't afford it. I'm a middle-class person and I could not afford holistic healthcare at the amount somebody who didn't have a great start at life needs, right? If I needed to lose 100 pounds, I cannot afford, $1,000 a month in personal training. Okay. So, right. Okay. I mean, that is significant. That's more than most people can afford. So I would say our competition is a provider who would rather do it without us, who doesn't want to help that person, and really just quick fixes and laziness. We're trying to figure out, when can we find somebody on the right day that they're ready to change their life? I believe everybody wants to change their life. You didn't go to school with anybody when you're in elementary school who said, when I grow up, I want to be overweight, lazy, homeless. Like, nobody said that in the 3rd grade. So at some point in everybody's life, they want to do better. And we're about right now trying to find, what day do we need to run into somebody when they're ready? I think competition for us right now is scarce in the sense of dollars and revenue. Nonprofits, sure. Every nonprofit's fighting for the same dollar. That's just an industry. That's any industry, right? But other than that, we don't have to put up too much of a fight to win over accomplishing our mission.
Well, that's well said, because what we do here at the college, we have an impact on changing all of our students' lives. Right. That's why they come here.
Right.
So do you have repeat clients? That they work with you and then they come back later and work with you again?
It's funny you ask that. So I would kind of call that a setback. I almost said a relapse, but same difference, a relapse, a setback. So we've had people who have lost weight and they didn't put it all back on, but they put some back on, and which is common too when you're talking about behavioral change. So we're also innovating a membership program. So because we don't want people dependent, right? And without giving too much away, I'm trying to change the industry, the holistic industry, and bring the cost down and make it affordable for more people. But it does need to become, the system of holistic wellness needs to become more like that of Western medicine, where appointments are shorter, consults can be lifelong consultations. People can do it, once a month or so. They can maintain a relationship. There's got to be a way for maintenance to be, because if you get sick, you always go to the doctor, right? But I'm not going back to a personal training bill every 5 years. I go through a life transition. Right? It doesn't make sense. It's just not going to happen. So that's part of what we're kind of innovating right now. So it's not there yet. Yes, we've had people come back to us, but we don't want them dependent on us. We want them able to sustain their education of it for life.
Thank you.
You're welcome. Thank you.
So Sarah, in the Western culture, I mean, you know, we've grown up thinking, you know, if you're sick or something's wrong, you go and you see a physician that's going to prescribe you a med for this or a med for that. I mean, what challenges do you face trying to promote or promote holistic healthcare? Because
Well,
that's something that we lack today in society, I think.
very much. And so you do have to find, now we're not against Western medicine. And I am very firm about that with people, because people say to me, you know, well, you know, forget Western medicine, pills this and pills that. And I won't take a Tylenol if I have a headache. I am that kind of person. However, Western medicine has its place in this world, right? So we really work with them. I try to stay very far from it's us versus you and anything. It's a conversation of how can we improve lives together. So when I go to a doctor's office and say, hey, we're here to improve patient outcome, they look at me and they go, oh my God, she's on our side. You know, she's not trying to shut us down. She's not trying to take everyone, right? I mean, people need to get physicals every year. People need to do X, Y, Z at their doctor's office. And doctors provide us tons of knowledge. So with Western medicine, I mean, again, it has its place. We do need to become more preventive, but we also are, you know, just in the nature of what we do, finding doctors who are also on our side, believe in what we do. I can't say that what we do is for everybody. Nothing is. But it's finding the right culture and finding the people who attach to that culture. And that's really what is our driving force. We work with them. And if we didn't, we never would have had a patient referral. They'd be like, she's nuts. She's going to tell them to never come back and see me again. We can't send them there. But we would never do that.
I've got a question for you.
Yeah.
As you start trying to get more and more clients and providers outside of Wilmington, do you plan on adding like a small office or something in order to be able to have someone that can engage with that community?
I would love to be able to do that. Yeah, I think being on the ground is really important. I mean, it's how I raise money here. Nobody wants to just, I mean, people have donated over the internet. People have applied over the internet that I've never met. But having the relationships, this goes back to kind of trying to change medicine, not being an assembly line. I would love to have an office there and or just have somebody up there working on the ground, because it's about relationships, right?
Mm-hmm.
So when you have that, you get much greater outcomes. I mean, every client who knew me personally, because we're so small, I mean, and they call me every day, they're like my friends. I'm going to have them at my wedding someday. You know, I mean, health is about relationships, and they thrive off of that. And so do I. So if we can do that, I think it would do the community much better.
My other question is, a few years ago, I had looked for a hostilic doctor for different purposes, and I found it very challenging to locate one, or I'd have to drive like 4 or 5 hours. So is there a plan that you might have, or this could be an idea for you, to kind of build like a how to find or network of these doctors that you recommend?
Yes, so we are in the process of finishing our software and new website, which on the homepage, I'm going to shout out Zillow because they have a great platform. But so it's a lot like Zillow, and you get to the homepage and it's a map where all of the holistic providers registered on our website, which is free to them, just by the way. Every time you move that map, all those holistic providers are going to populate, and they're all the people who we vet are actually licensed, certified. They have to put that into their portal, and we'll vet that. So they'll all be there. That'll be your kind of how to find them. Hopefully that's of great service to anyone in the world just looking for a provider. But it's hard for you to find a holistic practitioner because they don't advertise that they're naturopathic doctors, especially in North Carolina. You will have to go to one of the 26 states to find one legally practicing, allowed to practice. They've been trying to pass it here in North Carolina for 18 years. And I don't know a lot about those politics, but it's not passed yet. So often they'll advertise themselves as, again, yeah, like what you said, just that holistic practitioner. And there's only so many of them, I think, for that reason.
And the other thing that I noticed when I was doing the search is I'll be looking for like a practitioner, and it'll say hostilic doctor. And whenever you pull up their website, they're just a massage therapist. Is there a way to help with the, identifying I guess that would be a niche thing, but to me, that's not what I was looking for. So it's very misleading in that type of search.
Well, so holistic means a very broad industry. So we say that we provide holistic services, and that includes all the industries we provide. So a masseuse, in the sense, is holistic because they're not giving you pharmaceutical drugs, right? They're not giving you that quick fix. They're not, they're giving you something that comes naturally to them and you, right, together in that relationship. But holistic just means more natural. So if you're looking for a physician or a doctor, they have a title, and it's naturopathic doctor, homeopath, right? It's all the things that actually make them a board certified medical doctor, which they are. Naturopathic doctors are board certified medical doctors within 26 states in the United States. So I think it's also just knowing. I would do a little bit of research just on exactly what you're looking for. Are you looking for primary care? Are you looking for the masseuse, right? I would more so go away from holistic if you're trying to find somebody specific. I look up holistic just because I'm looking for 1 million people in that industry, in that whole world, right? So that helps us with our whole network.
Thanks.
You're welcome.
Sarah, I'm really interested in listening to your path to growth. And I'm a little confused, and maybe you can clear this up for me, but I'm not sure if your success is based on a push or a pull method of operations. You know, in 80% of all not-for-profits fail in the first 5 years. You're 4 years old now, so I assume you're going to make it.
Hope so.
Do you feel that you are being stymied more by the amount of money coming in, or the clients that you're meeting up with?
No, it's definitely the client stories. I mean, when you meet people and you get an application, you get one referral. And I've had clients who are just in the application phase sob over the phone that they found out we even existed. So, I mean, just couldn't believe that the option was there. That's always the driving force. It's a very emotional driving force. I don't believe that you can make it anywhere with just a pull of money, at least not make it very far or be happy with it by the end of it. I do believe that passion is what creates a great company. Our clients know that. And again, that's the relationship aspect, but path to growth. Now you're talking in the literal sense, how to get more clients.
No, what I'm talking about is how you grow with your company. And that is, do you have enough clients? Do you have more clients than you can handle? Do you have more money than you know what to do with? So to me, the push-through method is to get all that money and to start putting those offices you're talking about, getting people in there and then having them network their areas is another way of going and growing faster. Money always helps.
Yeah. Oh, money always helps, right? You do need financial capital to do what you do. Even if you're raising canned goods, you got to pay a payroll, right? I mean, yeah, money definitely helps us get there. So we're not forcing office space. I'm in a sponsored office space right now. I think that we can easily, find sponsored office space in Fayetteville. And if somebody would like to start out as a volunteer from the lack of finance to pay payroll for another person yet, then that's a way that we could start. I very much have been and continue to try to grow us organically, again, because I am one person here. We don't have more money than we know what to do with. We always need donations. Every nonprofit's problem is always needing more donations. I'd like us to get to the point where we're not reactive in funding, but we're proactive. And I believe the American Red Cross operates like this, is they have so much money that when they fundraise, that actually goes to the next catastrophe. And the fundraising that happened previously goes to the current, right? So I would love to get to the point that we fundraise so that it goes to the next wave of patient referrals, and we do get waves. So a couple weeks ago, I think we had 20 in a week or two, and I was like, couldn't even function for the 2 weeks just trying to get people enrolled. And then my fundraising took a hit because I'm not out prospecting all day. So we grow organically on the provider network when somebody's enrolled or when somebody's enrolling and wants to see provider X, Y, Z, and only Y and Z are in network. Then we call up and invite that provider. We say, hey, can we add you to the network? And that's how we've gotten to where we are now. Client-wise, how to grow and find more clients. Again, that's more medical center partnerships. That's more school partnerships. That's more employers who have employees that would benefit from this. So right now it's organic. I think we'll probably stay in an organic growth strategy for the next year or two. But we are looking toward more diversified fundraising. So we have a brokerage account to accept stock donations. We just got a grant writer for the first time this year, so that'll be helpful. I focus on anything from small to major gifts. We have somebody focused on our events and event coordination for all those kinds of donations. So that's also part of our growth strategy right now.
Well, I was going to ask you about grants, but I'm curious as to whether you're considering state funds as a steady stream of income.
We are. From the grant writer actually brought that up, and I'm completely not educated in the grant world, so I won't even sit here and pretend.
Takes a special person.
It does, and I swear we've got the best woman in the world for it, so I'm really excited.
So Sarah, we've got a couple of questions. One from Don. He wants to know, he says you can only work with the willing. Have you thought about finding groups online who are interested in weight loss, fitness, changing their lives in a holistic way, and then hold a free Facebook Live with some different providers?
We have thought about that. We thought about it, I want to say, actually, one of our providers and I talked about it about a year and a half ago, and we were just going through so many changes. And I always had another full-time job until this recent September. I just went full-time with Health Possible in September, even after 3+ years. So we have thought about it. There was a lot going on at the time. I think we actually will get to that point. Now, what we did start doing is not virtual, but like this, is called a Pay What You Can class, where we have providers host classes, whatever their service is, for groups where people can pay whatever they want or can, and it's actually a fundraiser. But what it does is diversify the community coming in the door. Somebody wants to pay $500 for class because that's their donation and they're entering a room for a community, great. If somebody's got a nickel and they're still gonna work out that day. So not virtual yet, but we have done it in person. And I think that's actually probably a simple concept we started, Pay What You Can classes that could be done virtually. And I would definitely be open to doing it. I'll look more into it for you.
All right, thank you. And we have another question from Catherine. She says, is there an income base for services for individuals with low income since you're a nonprofit, or do they just simply qualify for your services?
There's an income base. Scholarships go up to the 12% tax bracket each year, which changes annually. And then we have our own policies of what we scholarship in alignment with that tax bracket and all those different income dollars and cents. It is income based. We have had people not qualify for a scholarship simply because they make too much money, like I said earlier, the middle class struggles to afford high volume holistic care, right? So then we developed the concept of our micro lending program, which we're working on right now. And we have had clients qualify for a micro lending program who are just waiting. And that's still discounted care. We front the whole thing, exceptionally low interest rate that might be $30 by the time it's over with. So it costs you less than an appointment would. But so we are working on qualifying more people up to that upper class. And then our maintenance program, which will be a membership at some point, and that's for the whole community.
All right, thank you so much. Do we have any other questions for Sara?
Sarah, I really appreciate what you are doing to help the community, the health and the lifestyles. One thing I'm wondering whether you are thinking of maybe adding a well-respected industry leader as your advisor to gain quickly the reputation.
I have not considered that yet, but I am open to anything.
Okay. Yeah, because I'm in different industry. For our industry in the ag tech world, to gain reputation quickly, we usually think of adding a world-class leader or industry leader to our advisor team. So that could be helpful for the business development.
Yeah, please feel free to send me an email too. I sent it up in the chat. I'll send it again. So it's recently populated on there.
Yeah, I saw your email. Yeah, also a little bit of suggestion, when you do any presentation, maybe last page, you can put your contact information, also your organization website in the last page, so the people easily could catch that.
Yep, doing that. Thank you for the reminder.
Good, thank you.
And then there's one more question in the group chat. Have you tried to get some big sponsors for your program? You could start with your own banker and asking for business referrals to do the same. We do have large sponsors. So we have major donors. One is a business that gives, last year gave $17,500. That's Hey Good Homes. This year they'll sponsor us at a minimum of $24,000, which is awesome. And then other business sponsors will do in-kind donations. So print marketing materials, Southern Sign Company does that for us. Our bank, First Citizens Bank, is a donor of ours as well. And they also provide that financial counseling. So we do have sponsors. We're of course looking for them all the time. And I should have said this, I'm so glad this came up. We are launching our first ever awareness campaign. And without getting into too much detail, just to not hold people up here over the call, an awareness campaign is business focused. So if you own a business and you'd be interested in helping us fundraise and co-market together, I can explain what that looks like. Please shoot me an email, text me or call me today, and I will go over with you what's called our business pledge.
All right, Sara, I really appreciate it. I'm going to take the last question. What can this community do for you? How can we help?
Yes, if you know providers in the fitness, nutrition, or mental health industry, please tell them about us. They're typically also our direct lead to clients. So folks who are walking in their door are already trying to make that first move to change their life. We're walking out because of affordability. Those are lost prospects, and they're lost prospects due to finances. So that can be a direct referral to us. And it also brings providers to the network. Again, that organic growth that we currently operate with. And then as for donations, we can't do what we do without donors. So if you'd like to make the impact up there in Fayetteville, I would love to talk to you guys one-on-one about what that could look like, what we can accomplish together. So please do reach out and let me know, and we can take care of some folks up there in Fayetteville.
All right. Well, thank you so much. It's been a pleasure. Such a fantastic presentation, and a great company, by the way. You guys, thanks for joining us. Please come back next week. We've got a great presentation on tap. We have Mr. Jairi League. He is going to come and talk to us about Inatrix. Pretty fascinating business as well. Looking forward to that. I hope you guys have a great day. See you next week. Thanks for coming.
Thank you for having me, everybody.
Thank you, Sara.